Okay, so today we're going to be talking about candidiasis, and this is more commonly just known as yeast infections. So let's just go through this real fast. There's not a whole lot more to this other than just the notes. Most of the time it's caused by Candida albicans, but can also be caused by Candida tropicalis or Candida krusei. So let's take a look real quick at Candida albicans. Okay, and if you look here, this is Candida albicans. This part that you see right in here, these are basically spores. So if something happens to the Candida, what will happen is these will break off and they'll be in spores until they're in a better environment for it to break loose and grow again. And then this part of it is called pseudohyphae, is this part here. And this is the part, let me see if I can get a different color here real quick. All right, so this part that looks like sticks are basically called pseudohyphae. I don't think that color is much better, but that's pseudohyphae right there. So we're not there yet, but in a minute we'll be talking about how Candida actually tries to make itself longer so it can avoid phagocytosis. And most of the time, you have Candida in your body all the time. Normally it doesn't become a problem until we have a problem with antibiotics. And then what will happen is it will, things that compete with Candida will be killed off. And so then the Candida will be allowed to grow. So like I just said, the use of antibiotics kill off bacteria in the mouth and in the gastrointestinal tract. And this bacteria is usually used to keep the Candida in check. But when it's killed off, now Candida has no competition, so it's allowed to grow. And not only does it multiply in numbers, but what it will do, and like you just saw here, is it's going to grow long. And the reason it grows long is so that way it can keep from being phagocytized. So now it increases in numbers and it's able to resist your white blood cells because it's too big for it to be attacked by the white blood cells. Okay, so changes in the pH of the mucosa, that's just basically the lining of the inside of the mouth or the gastrointestinal tract, may do the same thing as killing off the antibiotics. Part of the reason for that, not killing off antibiotics, as the antibiotics are killing off the competing bacteria. Part of the reason for the change in the pH is what would happen is bacteria that needs a certain pH to survive would die off. And now when it dies off, there's less competition, so the Candida is allowed to grow. Like it says here, immunocompromised people or immunosuppressed people are more likely to have Candida infections on the skin and on their mucous membranes. On obese people or diabetic people, the Candida can grow in the fat folds. It's moist, it's dark, and that's the type of environment these like. And they're immunocompromised. So let's take a look. And so this is Candida inside of a fat fold. I know it looks like it's lips with maybe somebody having a little bit of a beard down here, but basically what's happened is this person's overweight and this is where the fat's folded over, and they've actually taken it. Usually it's going to be on the side, and they've actually taken their fat and separated it. You can see the whiteness down here because this is a yeast infection. You can see there's some whiteness down here, and then the redness that goes along with it due to the inflammation that may be occurring there. Okay, and I've moved, just in case this looks a little bit different, I actually moved the notes up a little bit. So we were just at this part right here on obese or diabetic people with Candida can grow on fat folds, which are moist, and it's dark. Infected areas become bright red with lesions. You just saw that, the redness on there. And then this can also, Candida albicans can also cause vaginitis or yeast infection in women. It's basically the same type of thing happens. So You can get candida in the mouth, right, on the mucous membranes and in the mouth, which we're going to see in just a minute. You can get candida in fat folds. You can get candida in the vagina also. So let's take a look at this in the mouth. And as you can see, this is a yeast infection of the mouth. It's candida in the mouth. Okay, and going along with candida, candida can get into the bloodstream, and when it becomes systemic in immunocompromised people, it can cause death. Systemic means it's going to get in the bloodstream and it's going to go to some system in the body and cause problems. Most likely, well, we've already seen it can affect the gastrointestinal tract, so it could cause problems there. Or the kidneys is another common area that people, when things become systemic, that it goes to. So fulminating disease is when candidiasis gets into the bloodstream and affects the organ system. Like it says there, it can lead to death. Okay, and then the last thing that can be caused by candidiasis or Candida albicans is thrush. And what happens in babies is they don't have enough microbes in their body to compete with the candida. As you get older, you get more microbes in your body, and now you have competition to compete with things. You might recall at the beginning of the year, we talked about botulism was like this. In adults, botulism is usually not a problem because it cannot compete with the microbes in the intestines. But in kids, it can. Or there's not that many microbes, so botulism can grow and cause problems. Same thing with thrush. We don't have a lot of microbes in the body, so therefore it goes and it basically you can get the candida in the mouth. Like it says there, kids forget and check, and it's a whitish overgrowth of the oral cavity, and it looks basically the same as what I put up just a minute ago. It looks basically the same as this, but imagine this just happening in younger kids. Okay, and that's candidiasis.